Denise Way. I am the primary investigator for this research project. I have two co-investigators. Their names are Dr. Roseanne Regan and Dr. Linda Wilson. The title of our research project is Cultural Competence through Standardized Patient Simulation in an Undergraduate Gerontology Nursing course. This is a pilot study. We thought it was important for nurses to understand and taking care of patients require culturally competent care. This is essential to nursing education and practice. Nurse educators must teach the importance of cultural competent healthcare for a diverse 21st century population. So our objective was to examine the effect of a standardized patient simulation on transcultural self-efficacy in undergraduate nursing students. We also thought it was really important when we started looking at articles. There was an article from the Institute of Medicine that also focused on the importance of nursing cultural competency for the 21st century healthcare systems. In their 2001 report, Coursing Quality Chasing, they looked at how can we decrease the healthcare disparities and provide culturally competent care. This was espoused also by the American Nurses Association, American Association of Colleges of Nursing, Specialty Organization, and Transcultural Nursing Society. We used the Jeffries Cultural Competence and Confidence Model and the Cultural Competence Education Toolkit guided the simulation project and pilot study. We also used the undergraduate demographic data sheet and this transcultural self-efficacy tool had an 83-item questionnaire measuring learner competence. This tool also had a high content validity of 0.91 and 3 subscales of cognitive, practical, and effective were used. We used 2 standardized patients, which was placed into the holistic gerontological undergraduate nursing course. Simulation 1 consisted of a Vietnamese cultural practice about a death of a husband with the wife at critical care unit bedside. Second simulation was about an African American man in the emergency department, identified by staff as a frequent flyer and med seeking who complained of a headache, high blood pressure, who suddenly dies in a wheelchair before the CAT scan. Again, this was a pilot study, quantitative, pre-test, post-test design. Design examining the effect of a 2 standardized patient simulation on transcultural self-efficacy. It was approved by the RRB. Students completed the survey and the questionnaire and Survey Monkey, and it was volunteer. We had 30 students at the beginning who completed the pre-test and the demographic tool items, but the results were the comparison of the transcultural self-efficacy scores. We have 2 charts here. We have a paired sample test and we have a paired box plot. So the results indicated no differences was detected with a small bias correlated effect size, illustration of the high variability with the sample depicted in a paired box plot graph showing individual participant variation. The limitations, the review of the subscales of the TSET indicated problem matching with the post-test. There was no significance far as gender, male versus female, and no significance difference by race. We had a problem matching in pre-test and post-test, subject response causing a decrease in usable data, resulting in decrease in the number from 30 to 6. Some of the recommendations: plan to complete a larger study, consider adding Jeffries' qualitative method tool. In conclusion, trends of the data from the pilot indicate standardized patient experiences may promote nursing student cultural competence and confidence using the Jeffries model and instruments. And to recommend this educational method, need to replicate with a larger sample size, possibly 41 students, and we believe we will get better results. Thank you for listening.